Alright, so hi everyone. So today our group's final project is focused on mobile health app. So to begin with, we are going to talk about the human cost of delayed healthcare. So I'm going to talk about two stories. And the first story is about Thomas Brady. I don't know if anyone of you heard that story before. If you haven't, that's okay. He was a 70-year-old US Navy veteran, and he was in urgent medical need. And despite multiple visits to the medical facilities, there was serious delay to his diagnosis and treatment. So those serious delays led to worsening his situation, and then led to his death. So he passed away on 2023. If you haven't heard his story, that's okay. I'm going to talk about a story of me. At least you guys know me. So, so in 2022, I accidentally cut my finger, my middle finger, and the blood just kept coming out. So I immediately went to the ER. However, my ER doctor didn't see my tendon had been cut. So I missed the perfect time to have the recovery surgery. And as the condition got worse, I tried to schedule an appointment with a hand specialist. However, there's a week-long wait list for that specialist. So after I finally met with a specialist, it already had been over half a month. So even though the specialist performed the recovery surgery for my finger still sustained a permanent damage. So you can see this finger, I cannot make a perfect fist right now. But it's okay, I always comfort myself, I'm not a boxer, so it's okay. And this is the picture of myself after the recovery surgery. Alright, so to prevent others experiencing the same situation, our group's solution is to create a mobile health app that combines with 24/7 online consultations, in-home doctor visits, and video sharing social media features. And we aim to provide every family with faster and affordable medical care, anytime, anywhere.
Let's begin with the fact. The United States has been a remarkable increase in healthcare workers. According to the Bureau of Labor Statistics, the nursing professions remain the largest in healthcare, with nearly 4.7 million licensed registered nurses. In 2023, the United States hospital employed over 7.4 million individuals, the highest ever recorded. However, this number represents the significant progress in workforce capacity. They do not translate to access to care for patients. Patient access is critically limited. 60% of patients wait an average of 7 weeks for a primary care appointment. Only 10% of them can secure same-day visit. This delays force 20% of patients change their doctors, disrupting the continuity of care. Secondly, the average physician appointment wait times has increased by 40% over the past decades in metropolitan area. For example, let's say dermatologists wait times of 35 days on average, which creating barriers to timely diagnosis and treatment. These delays compromise the patient's outcomes and escalate minor issues into major health crises. Moreover, only about 10% of emergency department visits are true emergency. Startling 60% are categorized as urgent or semi-urgent, leading to longer wait times and wasted resource. Lastly, the financial burden is immense. We can see the average office visit cost is cost $171. The high cost combined with the longer wait time result in up to 32% of 30% of a new patient's canceling appointment when delays exist for weeks.
Alright, so how bad is the harm? So avoiding or delaying medical care may result in late detection of disease, and also delaying medical care could increase the mortality.
Okay, let's talk about who is suffering it. In rural area, healthcare is a lot harder to access. We see fewer doctors, fewer surveys, and of a long wait time for getting an appointment. In fact, in some area, it takes 30 days to 40 days to get an appointment. Which means a significant portion of people in this area are missing out on timely care they deserve.
The issue can be traced back to several specific root causes. The first one is the increased demand for healthcare service. The population of the United States is growing, and with it, the number of people seeking care. Additionally, the aging population is also growing and requires more frequent and specialized treatment. The second one is the shortage of healthcare professional. Well, the number of healthcare workers has increased. There is a critical shortage in specialist fields and rural area. For example, rural counties often have fewer than half the number of primary healthcare providers compared to urban area. The third one is operational inefficiency. Inefficient scheduling leaves a primary appointment slot unused. While patients are able to see primary care doctor end up overburdening emergency room with non-emergency case. The last one is the economic barrier for patients. High healthcare costs are another factors. For many, these costs are prohibitive, delaying or preventing care altogether, which worse health outcomes and add strength to emergency resource.
Try unplugging it. Yeah.
Alright, so before getting into detail of our app, let's first take a look into the market potential for our mobile health app. Okay, so you can see here, it's increasing uptrend, and in 2022, the mobile health app, it has a $11.8 billion market size, and also maintains 12.3 compounded annual growth rate. Okay, so here we can see that our industry is in the middle between highly concentrated market concentration and fragmented market concentration. That's a good thing because in a low market concentration scenarios, startup companies need to invest lots of money to promote their products and to enlarge the market size. And on the opposite side, in a high market concentrated scenarios, there are already some like giant companies dominate the market. So it's very good that our industry is in the middle between them. That means we as a startup company, we don't need to invest lots of money to promote our products. Consumers has already been aware of our products, and there are not too many monopolies in the market right now. And you can also see here product substitutes. There are not many substitutions to our products, so that's great. Okay. So this is a slogan for our app, an app for timely, accessible healthcare at your fingertips. And this is envision interface of our app. So right here, you are supposed to communicate. You can supposed to communicate with your doctors, primary care physicians. Yes.
Okay, let's talk about our solution. Our application is like an integrated digital healthcare platform, combining online consultants 24 hours a day, 7 days a week, in-home doctor visits, and video sharing media. Let's imagine a scenario. When users open our application and they just watching some video through our video sharing media. They just swipe on the screen. Oh, this video talks about the neck and shoulder stiffness. Dying, I have some similar symptoms. Because I stare at the screen in my office all day long. So I will plan a consultation. Of course, users can also come in directly for a consultation if they suspect they have a condition. During consultation, our primary care physician will evaluate if I need a specialist. If I need, our system will give them some recommendation to reserve. I can learn about some specialists through our video sharing media. I will talk about them specifically later. And in this way, I can pick a specialist I feel comfortable and make a reservation. Okay, let's look at why it works. For online consultation, you can reduce waiting times. Waiting times, we're talking about immediate access to healthcare, which can really minimize delays for patients. And it can also increase the accessibility. It's amazing for rural outreach because the patient there will no need to travel to hospital. And also it is timely prescriptions. Quick consultation comes quick medication, and it's perfect for supporting chronic care. It also cost effective because we are not only cutting transportation costs for patients, but also focusing on efficient resource allocation. Okay, for in-home doctor visits, personalized care is really important because doctor can go to the patient's home and give them some personalized care and provide some individualized plans. Now, emergency convenience. It's no need for some patients to visit the hospital for their minor issues. And you can also avoid some long waits and exposure. And it also can enhance the patient comfort, and it will give us accessibility for limited mobility. Okay, this is our in-home visit doctor visualization. We can choose a doctor in our neighborhood, or if we need a specialist, we can choose some clinic. For video sharing social media, I noticed that some amazing content creator in YouTube who have also medical background. So imagine if we bring this concept to our platform, like TikTok or YouTube, for certified doctors, and they will have their own profile, and to build trust with patients and give some educational content that showcase their expertise. It can also keep them expanded with platform because the doctors can monetize their knowledge, and which can make the content creation win-win for their reputation and income.
Alright, so now we are going to talk about our implementation plan. And the first step is we plan to launch a pilot program in Boston. And during this step, we decided to partner with 10 local clinics and hire at least 50 licensed nurse practitioners. And so, Zhengwu, why we choose to launch our pilot program in Boston?
Because it takes 7 days long for Boston residents to see a doctor.
Okay, so our next step is to expand our market to the Midwest area. And why we chose to expand to Midwest area is because this area has longer average wait time than other areas. And during these steps, we plan to integrate and collaborate with other insurance providers such as United Healthcare, Cigna. And our last step is to launch the product nationwide. And during this step, we decided to negotiate and discuss with the pharmaceutical companies for medication delivery. So, in conclusion, our group found out that there's a big issue in long wait time to reserve a specialist, and there's a huge high cost for those uninsured patients, and there's also a potential harm due to delayed care. And our group's solution is to create a mobile health app that has 3 main features. First, 24/7 online consultations. Second, in-home doctor visits. And third, interactive video sharing features. And as I've just mentioned, we truly believe that our company, our startup company, can survive in the mobile health app industry due to the characteristics and market potential. Thank you.